my parishioners go to that hospital because if I was sick or my family was sick, we would go to Pottstown Hospital. I'd like to see it to be the best that it can be. And right now it is not, because CHS has chosen to make money rather than be caring. We've gone from being a caring place to a business.
This hospital is one of the major employers here in the city of Pottstown. It might even be the biggest employer here in Pottstown, since some of the other major companies have left over the years.
It is my hospital, and I feel proud to work there. So, you know, I do use it. And the thing is, it's close, and it's something, I mean, if your child is sick, you don't want to have to drive miles away.
When I first started at Pottstown, it was almost like a family that you were joining. Everybody knew everybody. We knew all the doctors' names, all the nurses' names. It was very, like, family-oriented. But now that CHS came, it's more like, it's a business.
Just to see the change from nonprofit to profit is a big difference. I mean, big difference. The care of the people, to me, now it seems like a factory. Everything is money, money, money.
They do, I call it MASH care to patients that don't have health care. They get them in because the law requires them to take them into emergency. They give them quick treatment enough to get them out.
I mean, we have a tough time in my department just getting equipment. They're very, the word is stingy is the only way to really say it.
And I think they're losing the whole community concept of this hospital. And to me, a community is taking everybody in, whether they're rich, they're poor.
There's a gap anymore in this country between the rich and the poor. The middle class really is shrinking. We know that in 2008, they made $218 million after taxes. They're projected to make over $240 million in 2009 after taxes. And what we want is for the community to be behind us and say, if you are making this profit, why do you have to take away from the employees? Why do you have to take away from your patients coming into the hospital?
Recently, my husband took sick, and I don't know what's going to happen. I mean, is his medical bills going to be paid for? Do I have any kind of opportunity to improve his health? And I'm up in the air, and I don't know which way to go, whether to, you know, look for another job, a second job perhaps, because I don't know where my benefits are. I don't know, like I said, who's paying the bills. So I find it very hard.
Our contract expired the end of August. We've taken 2 extensions up until November 10th, and since then we have been without a contract. They want to take away our pension. They want to increase our insurance by the full-timers by 40% and the part-timers by 400%.
We're asking for reasonable things in this contract. There is nothing greedy, nothing demanding about them. You know, I basically was the primary breadwinner in my house while my husband was recovering from his accident. I mean, I have 3 kids. I'm not hawking the bank. You know, if anything, I'm probably, you know, far from that.
Well, I am personally within 5 years of retiring, and I feel my pension is very important to me. Like I said, I have a family member that is sick at this time, and I'm using monies that I have saved towards that pension now to help take care of that individual. So I find my pension is necessary.
Well, the health care is really big, and I'm really, especially for full-timers and especially for part-timers. I
started here as a part-time employee, and one of the things that they want to do is separate the part-timers from the full-timers for benefits. And I am now a full-time employee, but we want to keep the part-timers in with us because it's not economically beneficial to them to have to be separated from us. We've always felt, since this union's been here, that the part-timers are equal to the full-timers. It's just they can't put in as much time.
A lot of part-timers have already said that they would have to quit because you're ultimately paying for your health care. There's nothing left. You know what I mean? It's either feed your family, have a house to live, or pay for health care.
I will choose not to go to the hospital for certain things. I mean, I definitely send my kids no matter what, but, you know, we will be refraining at times from going. It's going to be a burden. I'm hoping, you know, my husband has been out of work because he had an accident, so he's back at work, so I'm hoping that'll help us, because when I look at what's offered in the contract this year, I mean, I'm going to be behind the 8 ball, definitely.
If you are treated properly, then you know you're going to give the care that the patient needs. And that's what the ultimate thing is now.
I'm going to give good health care because that's part of my integrity. And I believe everyone here will, regardless of whether we get a lousy health care plan or our benefits aren't too good. But it's a statement of how the hospital, if the hospital doesn't care about the people that work here, what makes you think they're going to care about the patient?
You know, we provide a service for the community, we try to, and they don't see that, they just see the dollar signs.
In healthcare, there should really only be so much profit you need to make. Healthcare is actually for the benefit of the people, not for your wallet. We've taken the first step to fight CHS.
I feel that we need to be the leader. We need to lead, and we need to fight for the pension and for the health care. I mean, we work in a healthcare facility. I think that we should fight for that.